Hello everybody, welcome back to my channel. Today I'd like to talk to you a little bit about the issue of weight. Excess weight is a problem for a lot of people. Despite carrying on extra weight, people are always looking for solutions, trying to find ways they can deal with it. And of course they come to me asking for various procedures to be done, whether it be that their chest, their thighs, their stomach, lots of areas that are a problem for many patients. So they ask for some solutions. Now the thing is this, a lot of patients have tried to lose weight prior to coming to me. As a result of that, they've lost maybe a few pounds. They haven't sort of gone the full hog in terms of getting to their target weight, but they've lost a substantial amount, and they find those last few pounds are so difficult, so tricky to lose. So they then come for some assistance and come for some help. And so I see patients and I advise them accordingly what I can or can't do. Now, be that just some liposuction, which is fat removal, using some suction, that's very helpful for a lot of cases. In other situations where there's also an excess amount of skin loosening or skin laxity, you then have to deal with it, and we have to tighten, remove the actual extra skin. So that sometimes involves a tummy tuck, which I'm sure a lot of people are familiar with, that term, that phrase. Abdominoplasty is the formal term for that. Or maybe we do some tightening on loose skin on the arms. Again, that's called a brachioplasty, removing excess amount of skin from around the arms and tightening things. The same applies to the breasts, where breasts have become a bit saggy, a bit loose. So there's many solutions for different problems. Many people ask me, how much weight do I need to have lost before you will consider me as a candidate for surgery? And in general, we have some guidelines that we base on. And we say to patients that you have to be ideally within 10 to 15% of your ideal weight prior to having any surgery. The reason is this, is if you're carrying a lot more than that, I'm much more limited in terms of what I can do to make an improvement, because from my point of view, I can remove some excess skin, excess amount of fat that's in the sort of offending region, if you like. But if you're carrying a lot of extra weight, it probably means you got a lot of excess amount of fat in the neighboring areas. So, by me tightening one particular aspect of, say, your torso, you're still going to have a lot of weight around it. So, the impact or the improvement is going to be much more limited. So we tell patients, in order to make it better for you, lose weight and lose as much as you can coming up to any surgery. Now, I also see a lot of patients who are way off their target, okay, and yet they're asking for some improvements. Now, in those patients who are asking for some improvements and yet they're way off their targets, I usually suggest they need to lose some weight. Now, some surgeons are very abrupt with their patients, say, go away, listen, you're not ready for me, I can't do anything for you, just come back to me whenever. I think it's a little bit sort of unfair for me to start taking that kind of attitude, because I know a lot of these patients are really struggling hard from a psychological point of view, whatever, just to lose that weight. So for me to just say, dismiss them and say, go away, come back when you're ready, is a bit mean-spirited. So I usually like to tell people, I want to sound more positive. I want to sound encouraging to these patients, okay? So what I usually tell them is we weigh them and we say, this is your weight at the moment. We know what your ideal target is. Again, when we talk about target, we have to be quite realistic, because I always tell patients, you can look through all the charts and they'll tell you what your BMI should be according to your weight, but we all know, these are way off the target many times, and so everybody's got a different realistic ideal weight. So we try to stick to the realistic ideal weight for patients, and we say, listen, you've got to help me to help you. So all I'm asking is for you to sort of meet me halfway through, where we want to be. I can then pick up from there on in. So we set a target weight that we'd like to see these patients, and I usually organize another consultation for them to see me in about 3 months' time. And so at that point, hopefully, they have some incentive to lose the weight and to help themselves. Because I think if you have a target to meet, you sort of feel slightly embarrassed, and you think, well, I got to do what I can to keep my word or my end of the bargain up. I find that really helps the patient, and when you do, they're much more accommodating to losing the weight, and therefore ultimately they can have their operation. So it's something that we can't be strict about, we can't be rigid about. We have to understand the position the patients are in. A lot of these people are struggling with a lot of weight. So, and also, I try to offer them guidance as well. I try to find out what their weak points and why are they Why can't they lose weight? I mean, what are they eating? What's their regime in terms of exercising? That kind of stuff. And a lot of patients, although we can assume that everybody knows what's good for us to eat, for example, a lot of people don't. You ask them and they think it's clearly this is not the right diet for them. So you then sort of try to offer them some advice, and then obviously again try to tell them maybe add a little bit of exercise. But again, I tell people the most important thing between exercise, and diet, it's always diet, because you can gain 500 calories in 5 minutes. To lose 500 calories at the gym, you have to spend a good hour and a half. You simply can't out-exercise a bad diet. That's the bottom line. Okay, so I tell people, between the two, forget about exercise. I know you might be stiff, you don't want to do exercise. That's fine, but you can control what goes in your mouth. So providing you do that, and you're sensible, and you do it in a very staged, strategic way, you don't want to sort of crash diet. Crash diet does no good for anybody, because all you do is you really get down to a weight that you want to through a crash diet, and then you find you rebound, bounce back up again within no time at all. So you're not doing yourself a service at all. So I tell patients that you have to do it gradually, progressively, and at the end, it's going to be a lifestyle choice. It's not just for meeting that aim or meeting that target. It's forever. You get to that stage, you get to that weight, so you can maintain it. Okay, so you got to get used to that. So providing they understand these few principles, then I'm here to help and give them advice to do whatever I can in order to get the best possible result that they can. That's a few little points and a little bit of insight in terms of weight loss and what you need to do in preparation for any surgery. I hope that was helpful for you. Please do subscribe to our channel. If you want to hear more, we'll come with different topics every now and again. Many thanks. Cheers.